biceps tendon. Like be sure that you're gonna be there, and then performing the friction with a relaxed position. You are targeting the structure below the transverse humeral ligament. But when it comes to the structure, if your patient are pointing really deep inside the joint, then it's gonna be between the sheath and then the tendon, right? So then you need to put your patient into the stretched position to actually perform the friction, right? If you are planning to do so. So then you need to have your patient all the way to the side of the table, and their arm is going like that way, and then you can actually do these things, right? It's a little bit tricky there. But you can working on the biceps muscle anyway, right? And then like for the brachialis muscle is underneath, so you can compress together to working on, but actually you can go in between two and with the patient motion. So I'm gonna have you to move your arms slowly back and forth, right? Just give me a second. And you're gonna palpate the muscle underneath, like a biceps muscle belly is here, and your finger is at the side here, right? And I get to bring it up, and then slowly bring it down. So you're gonna kind of moving your fingers up to feel the muscle belly, and then tear the between the biceps and then the brachialis in that way. So your patient has a less sensitivity there, right? Less tension. So you can working on that one too. And where is the subacromial bursa? So it's underneath of the deltoid. If your patient actually have the case, so then swelling is gonna be like acromion is here. There's no way that they can swelling up, right? So it's usually not anterior posterior side, it's a side. So when you find their acromion, it's gonna be around like this area. But like when it's working up like deltoid area, it's gonna be like that way, right? So then when you need to treat that condition, you may need to go around it, right? So you wanna working on the edge. It's never spread too far down here. So you're gonna stay more like a half upper part of the deltoid area, then it should be fine, right? It's not gonna be go all the way down to the deltoid even. So you're gonna be go around underneath of the acromion. It's not over the acromion, it's underneath, right? So like this way, then the marking it, right? Or like if you wanna perform some C-scooping, it's gonna be like that way, right? So if I show you guys here, this is the side of it, right? So then C-scooping, right? Or like you can working on the edge around that area like this way, right? That's gonna be the stuff. Deltoid